Hello and welcome members of the International Conference on the Medical Device Industry. This presentation will delve into the ethical and safety issues while also exploring the costs and accessibility of magnetic resonance imaging, MRI machines, and examine their broader impact on communities around the world. MRI is vital in modern diagnostic medicine, providing a highly detailed visual of internal organs and tissues. The need for MRI scanners arises from their ability to safely detect a wide range of medical conditions early, including tumors, neurological disorders, and joint abnormalities. MRI works by using strong magnetic fields and radio frequency pulses to manipulate hydrogen atoms in the body, which emit signals that are caught and read by a machine, translating into detailed images of internal structures. This technology provides distinct contrast between soft tissues, making it valuable for detecting issues like brain, spinal cord, liver, and heart conditions. MRI's versatility and precision make it essential in modern healthcare. Recent advancements in MRI technology have resulted in faster scans and improved imaging, such as functional MRI for tracking brain activity and diffusion MRI for studying neurological pathways. These enhance its diagnostic capabilities and pave the way for greater medical insights. However, accessibility remains a concern to low-resource regions due to the high cost of machines and maintenance. Moreover, despite MRI being safer than other imaging methods, ethical concerns regarding its availability, costs, and patient safety, such as those with metal implants or claustrophobia, continue to challenge healthcare providers.
Despite the widespread use of MRI in developed countries, ethical considerations surrounding the accessibility of MRI technology highlight significant disparities in global healthcare, with an MRI machine averaging around $2 million. Statistics show that approximately 66% of the world lacks access to MRI, with low to middle income countries having 1.1 MRI units per million people compared to 26.5 units in high income countries. This disparity highlights the unequal distribution of medical resources. In sub-Saharan Africa, a survey conducted showed that 40% of MRI scanners are low-field units, with 80% still in use despite being outdated. MRI facilities are primarily available in urban areas, making accessibility more challenging for rural populations. This contributes to patients in these areas facing delays in receiving critical diagnosis or being unable to access MRI imaging at all. Furthermore, MRI machines are costly to purchase, maintain, and upgrade, affecting healthcare systems globally, especially in low-income settings. This leads to a limited number of machines in underfunded areas, forcing patients to travel long distances for access. Additionally, the higher costs can be a barrier for those without health insurance. Efforts to improve accessibility include the development of more affordable portable machines for low-resource settings or exploring healthcare policy changes, reducing the financial burden of scans. However, costs and accessibility remain significant barriers to widespread MRI use, particularly for marginalized populations.
Accessibility, the ethical concerns also extend to the responsible use of MRI technology. Overuse of MRI scans in high-income regions adds unnecessary costs to healthcare systems, potentially diverting resources away from other critical areas of patient care. Studies showing that 30% of all imaging procedures in these countries are unnecessary, driving up healthcare and financial costs without significant patient benefits. This raises questions about balancing the availability of advanced diagnostic technology with its rational and equitable use. Prioritizing patient safety and comfort during MRI use is crucial, as high magnetic fields can pose significant risks, particularly for individuals with metal or medical implants, as not all implants are compatible with higher field strengths. Comprehensive screening tests are undertaken to identify ferromagnetic objects, preventing accidents and ensuring safe scans. For example, while many implants are compatible with 1.5T scanners, others may not be deemed safe for the use in 3T scanners. In addition, claustrophobia and anxiety are significant challenges during MRI procedures, with approximately 25% of patients experiencing anxiety and 13.7% of cases suffering panic attacks. This anxiety may result in interpreted scans affecting the quality of imaging and the overall patient experience. To mitigate this, healthcare providers may provide detailed explanations of the procedure, utilize open MRI machines, or increase machine diameter. For cases where anxiety persists, Facilities may implement sedation or physiological therapy.
There have been multiple upgrades, including image reconstruction, more powerful computers, increased radio frequency channels, and stronger magnets. All these improvements aim to provide clearer imaging for specialists to work with. Two methods used to improve imaging quality include diffusion-weighted imaging, DWI, and functional MRIs. DWI is effective in diagnosing tumors and distinguishing between malignant and benign tissues by utilizing the diffusion properties of water in the tissue. Although fMRI is uncommon due to its limited benefits in the medical world, it is used in neurosurgery, allowing us to see active areas in the brain through blood flow, which is beneficial when operating on brain tumors and other surgical procedures. On top of this, AI is being introduced to improve image quality by reducing blur caused by patients' movement during the imaging process. This is done by reproducing images based on the patient's movement, resulting in a clearer and more accurate scan. Their new systems are complex, expensive, and require vast training, and therefore need to be factored into making them more accessible for rural and developing areas. Many are working on making the price of the magnet more affordable.